Hi, this is Dr. Kahl Goldfarb with Water and Sports Physical Therapy. We're here today at Fitness Quest 10, one of our 6 locations in San Diego, and we're talking this week about how to live without the fear of pain. What we want to do is we want to do 3 things today. We want to talk about what pain is so we have a better understanding of it. We want to talk about how fear of pain makes us worse, and then we want to talk about how to eliminate pain so we don't fear it and we can move forward in our lives. So the first thing we're going to do is talk about pain and understanding where it comes from and why it is helpful and beneficial as well as hurtful. So pain obviously is a message from a part of the body to your brain, and your brain picks up this message and perceives it either correctly or incorrectly. So an example of pain that is a good message is if anybody's had an ankle sprain in the past. So when you sprain your ankle, if you think about what happens, or if you almost sprain your ankle, you'll feel pain. The ligament in your ankle tells your brain you're gonna rupture that ligament. So instead, it will tell your knee to buckle. That buckling effect will protect the ligaments and the bones in your ankle. This is an example of pain that you need to receive the message so you can respond to properly. An example of bad pain is in a frozen shoulder. If anybody has had pain in the shoulder and they lift their arm up, when you lift your arm up in the air, it might hurt. So the normal response is, let me not lift my arm. So you only use it to here. And then after 2 weeks, that hurts, so you only use it to here. And over time, the joint capsule freezes down. That's a poor response to pain. And we'll talk later about knowing what pain would be that would be good and bad, and by not moving your arm, you actually cause a poor response, which is an adhesive capsulitis. Back pain is the big question, and that's where we really want to dig into today. With back pain, it's very difficult to differentiate what's good pain and bad pain. So in the spine, let's take a look here. This is an example of the spinal column. There are nerves that run through the spinal column all the way up to the brain. This messaging can get confused. So normal pain would be if a joint or disc or a ligament is damaged, a message would hit this nerve. Nerve goes to the brain, and the brain says, okay, I have pain right here. If you have pain for a prolonged period of time, over 4 weeks for example, and it turns to a chronic pain, this message gets confused, and the messaging to your brain becomes incorrect. And you'll feel messages that are not from where they should be. You'll have referred pain from places that really aren't giving you pain. So you might perceive pain from here, from down through here, from down the leg. It might still be coming from the same place, but your brain mixes up the pain signals. So it's very important to understand that some messages are good, and if you had pain for a long time, some messages are bad. The most important thing you could do is understand where the source of the pain is. If you figure this out, the anxiety and the fear goes away. So that brings up the topic of how do we eliminate the anxiety of pain and what gives us anxiety. You have to understand that when you have pain, especially severe pain or pain over a long period of time, the sympathetic nervous system or autonomic nervous system, which is your fight or flight mechanism, kicks in. So when you have a lot of pain, you might feel nauseous. You might feel perspiration, increased heart rate. This is your body's response to pain. And what we want to happen is you have to calm that system down. That's a secondary system which should not be involved unless it's a very serious problem. In a case where it's not serious, the sympathetic nervous system will make things much worse. So what you want to do when you start feeling these messages from the back, or from the leg, or from your arm, you want to relax, take a deep breath, and try to calm yourself down. By doing this, you're telling your sympathetic nervous system to shut off, and you want to deal with the correct nervous system. Once you figure out, by seeing a valid practitioner, somebody you can trust to figure out the underlying source of pain and not just treat symptoms, once you figure that out, you'll understand what you can and can't do. Which brings us to the point of how do we eliminate the pain? If we understand that the pain comes from a disc in the back, for example, then either bending backwards or forwards would cause or alleviate those pain symptoms. Well, what we don't want to do, the worst thing you can do, and studies show this, if you rest and do nothing, your pain will only get worse. And when you come back from that, you will have a worse recovery and multiple reoccurrences of the same problem. What you should do is you should exercise, but it's very important to exercise in a pain-free manner. There are certain areas, especially in the spine, that are lost and forgotten in the typical exercise world. And the muscles we usually look at are called multifidus. Looking at the spine, the multifidus are muscles that connect from one joint to another, from one segment to another segment, and they go into extreme guarding when you have pain. These little muscles will tighten up and not allow movement to occur. So a big long stretch in the back will not do anything. What has to happen is you have to actually work on these small muscles. And small motions, like rotation, are going to be helpful. Side bending are going to be helpful. Things to move these on a small level are what are important, not big, large movements. If you're having pain, don't try to play sports. Try to do movements that used to hurt, pain-free. So small movements, tailoring your exercise programs so you're not moving through pain, because no pain, no gain is not an option. We do not want to think about no pain, no gain. Find what hurts, figure out the asterisk sign. That's what the pain is, when you cause it and how you cause it. If you can figure out what the causes of pain are, you can tell a practitioner what they are, they can help guide you in the right direction. So you can understand pain, you can understand that fear is not helpful, and then you can understand how to eliminate pain. And if you do have it, you calm yourself down, you calm down the nervous system, and focus on the direct cause of pain, and you can definitely eliminate your pain.